A COVID controversy is raging across the country, raging in provinces like Ontario. For example, did the provincial government there ignore the advice of some of its own public health officials when they launched their new restriction plan? Doctors from Public Health Ontario told the Toronto Star that the Premier didn't even heed their advice to keep the thresholds a lot lower for restrictions. They had advised the toughest restrictions to kick in at 25 positive tests per 100,000, not 100 cases per 100,000 or 10% positivity rate that the province accepted it. Doug Ford first shot back, saying, "I have the support of my Chief Public Health Officer, Dr. David Williams," but then on Friday, he backed down and changed the levels. But with Ontario breaking COVID records, every province is suddenly seeing dangerous spikes. Are the provinces doing enough? Is a total lockdown coming? To talk about that, the scrum is here. Joyce Napier, CTV's Ottawa Bureau Chief. Dr. Abdu Sharkawy is CTV's infectious disease specialist and our special guest. Also joining us, the former NDP leader and now our CTV political commentator, Tom Mulcair. Good to see all of you. Doc, I got to start with you. You're on the front lines, and by the way, we always thank you for your incredible work. Cases are spiking everywhere. You looked what happened where you live in Ontario. What did you make of those restriction levels and what's being done right now?
Well, first of all, let's say that it was rather shocking that the red zone, the restriction levels being the highest, it has taken this long for that to be advanced to other areas besides Peel Region, for example. That should have happened some time ago. It's obviously disconcerting that there was this dissonance between what the Premier had said in terms of how these restrictions were mapped out and what our public health experts and epidemiologists said was actually the case. We're in a pretty dire situation right now. I think it's becoming abundantly clear. This is a nationwide crisis, really with the exception of the Northern Territories and the Atlantic bubble. Everyone is really experiencing a serious resurgence of cases of COVID-19. And I think the principles of containment need to be uniformly applied across Canada. I think that the error that we've made is going through this piecemeal approach of wait and see, going through a nuanced, dance, if you will, of COVID-19. And the dance isn't working anymore. We're breaking each other's legs. We're doing it economically. We're doing it in terms of lives that are lost. We need the hammer. And that hammer needs to be applied with conviction. It needs to be applied with some assertiveness. And we need to apply the support that's necessary from an economic point of view to the people that would suffer if that hammer is laid down. But make no mistake about it, this nuanced approach is going to fail. It's too late, and it's not significant enough to do the trick.
Tom, let's talk about incrementalism. Quebec, the Premier there, talking about shutting down schools. New restrictions in Alberta, but they still allow weddings of 50. What do you make of this incrementalism? They're all saying, look, we can't just shut down because we'll destroy businesses.
If only we could have had the clarity of Dr. Sharkawy across Canada. I mean, that's the number one problem that we've got. We do not have consistency from province to province. A lot of the decisions are more political than they are public health, and that's a real problem. In the province of Quebec, for example, they decided to go ahead with Halloween across the province against all common sense. Now, almost 2 weeks after Halloween, we're going through a huge problem. We've got big spikes, and they are obviously connected, according to all of the observers. Yesterday, I was listening to Premier Jason Kenney in Alberta saying, well, we've got to get really tough. So last call in the bars around 10 o'clock. There shouldn't be any bars open right now. That's the obvious thing, but they don't want to make that decision. So I think that at some point, there's going to have to be leadership. I think that Mr. Trudeau has a lot of tools in his toolbox, and he should be using them and show some sort of leadership on this. Because you know what, Evan? It is dire, and I'm not an alarmist, but I am alarmed at what I'm seeing across the country right now.
Joyce, look, they've been asked about the emergency measures. The federal government has not even touched that. What do you make of the federal response and then the provincial responses, which, they're talking about maybe a lockdown, but there's a lot of incrementalism.
I understand the politics of the pandemic, and you can't deny them, and you can't cast them aside. The premiers want to get reelected. These are politicians, and even if it is a pandemic, they remain politicians. So the federal government doesn't want to intervene because it would look like, bigfooting the provinces and into their jurisdiction. the provinces. Listen, you heard Doug Ford not long ago. He's being pressured by businesses. He said, look, I mean, you guys, it breaks my heart. I get their phone calls, Premier, I'm losing my business, I'm losing my house. So, you know, there's a lot of things to take into account. The bottom line is the cases are not going down, right. So we have to get draconian, and we have to do it, right. Even if it's for 3 weeks. Let's do it.
Okay, Dr. Sharkawy, a lot of doctors are saying we need something called a circuit breaker, 2-week total lockdown. On the other side, I've spoken to the head of the Canadian Federation of Independent Businesses and said this second wave is going to cause tens of thousands more businesses to go bankrupt. First of all, will a circuit breaker actually work in the short term and actually allow the economy to open up? Is that what we need?
I think that's exactly what we need. And believe me, I get a lot of negative attention, a lot of flack from people in small business communities. And I understand their frustration. I understand their sense of despair and desperation. And I want them to survive. I want them to get through this. But I'll tell you this, I can't imagine how allowing these small businesses to operate at 30% capacity, 50% capacity, even 70% capacity is going to keep them afloat. What they need is to function and operate at 100% capacity, and that's not happening right now. So we need a situation that's going to be able to really get our numbers down to allow them to operate in the kind of environment they need to survive.
Right.
And a circuit breaker is one way to do that, where we jolt our entire community into recognizing that this is not something we can take any liberties with. It's a finite period of time. There's no ambiguity around it. There's no way that you should find loopholes to do X or Y or Z. You do what you're supposed to do. You get those numbers down, and then you open up.
But and
then you give those businesses a chance to survive.
Tom, I get it, but it's harder than you think, because you got businesses, you're going to let Walmart open for groceries and not the small business. We haven't spread. We've done all the right things, so big box stores open. We can't. Kids go to school. We can't open. When you get to the details, it's darn difficult to do the quote total lockdown and the circuit breaker.
Right. But we should also be learning from the mistakes of the past year, and we should be coming up with a system of sharing best practices and, if need be, imposing them. I mean, if you look at BC's result, right now they're getting a lot of cases, but their total deaths from COVID-19 in relation to their population are still incredibly low. If you look at Quebec has over 60% of the deaths from COVID-19 with only 22% of the population of Canada. It's been a disaster. But right now we're seeing that disaster preparing itself on some of the Western provinces, because we're looking at the long-term care centers and all of the explosions of COVID-19 in those many centers. And I'm saying to myself, did nobody learn from what we just went through here? It's a disaster what we went through here in Quebec in long-term care. And I'm just so concerned. And I'm so relieved to hear Dr. Sharkawy speaking with such clarity and such common sense. I'm just wondering why it is that those best practices have not been imposed instead of just being suggestions as they are now.
Joyce, last word. I know that we had some hope this week. We hope that vaccine comes. Folks, it's going to be middle of next year and maybe the end of next year till most people get that. So the vaccine's still a long way off. So last word on, we got a long dark tunnel ahead of us.
Well, we do, and you heard the Prime Minister last Friday who said, he had 22 meetings with the premiers and told them this time, listen, we're going to have to make some very difficult choices if the cases keep climbing. I want to know what those difficult choices are. Will it be between the COVID patient and the cancer patient? I know that it's difficult. You said it well, between the big business, the big box store, the small businesses. But at one point, we have got to stop we've got to stop these cases that are rising, and if it means the circuit breaker, then maybe we should do that, because those difficult choices ahead, I feel, are worse than what we're talking about now.
All right, I got to leave it there. Dr. Sharkawy, Tom Mulcair, thanks so much for joining us. Joyce will return later.